So if you're preparing for the MSRA clinical paper, have a look at this example question. Okay, great. So Lyme disease, type into the chat, what's a first-line treatment for Lyme disease? It's in the question. Doxycycline, right? So first line, they've been given this doxycycline, and then less than a day later, they come back with these symptoms: fever, facial flushing, bit tachycardic, blood pressure is a little bit low. So what's the likely cause of the symptoms? The correct answer is D, the Jarisch-Herxheimer reaction. It's quite specific side effect that's quite common when we give someone doxycycline for Lyme disease. Common enough that it's recommended that you warn the patient that, look, this could happen. About 15% of patients that you start antibiotics for Lyme disease, they get this specific side effect. And if you don't warn them about it, that this is actually a reaction that's known, keep going with the medication, what do you think might happen? Patients start taking the medication, they start getting these things which make them uncomfortable, they stop taking it. Then, of course, the risk is that their Lyme disease isn't treated and they become more unwell. So that's why it's specifically mentioned to talk about this, right? So the Jarisch-Herxheimer reaction can actually happen with any antibiotic treatment, but it's really common when you give doxycycline for patients with Lyme disease, okay? If you look in the BNF, things that are seen in more than 10% of patients are described as very common side effects. Okay, so it's very common, right? Usually will occur within the first 24 hours of treatment. And actually it's because it's working. It's starting to work, it's killing the bacteria, and the bacteria, when it dies, releases toxins, and that reacts with the antibiotics and causes this reaction. So you find that their fever gets worse, their muscle pains, headache, and then they might be tachycardic, hyperventilating, they get flushed, blood pressure drops, but only a little bit. So can you think of other infections where this is commonly seen? This is probably the one where it's very, very common, but there's at least one more where it's common enough that we'd warn patients about it. And then another one where you might see it as well. Type into the chat. Yeah, well done. So syphilis is the one where we always warn them because it's common, and leptospirosis. But syphilis, very, very another important cause of this reaction. Okay, this, by the way, is one of the 112 case cards. So if you found that helpful, this clip was taken from our MSRA Masterclass webinar. You can watch the 75+ minute recording to cover lots of questions and boost your preparation. I'll pop the link down below.